So I'm Dr. H.L. Greenberg. I'm a board-certified dermatologist practicing in Las Vegas. The name of my practice is Las Vegas Dermatology. I thought it would be nice to take you on a virtual tour. I'm going to walk backwards so that you can see sort of the waiting room and where we are here. My practice started in 2007, and I have another doctor and a physician assistant working with me at this time. We have 5,000 square feet of space, and the practice is both medical, cosmetic, and surgical dermatology.
Yes.
So, yeah. This is our laboratory. We do Mohs micrographic surgery in the office, which is a skin cancer surgery. So that's our, this sort of our surgical bend to what we do. People who have skin cancers, and there's a lot of skin cancer in Las Vegas, they can have the cancer removed, and then in that lab that you saw, have the tissue placed on a microscope to be evaluated for if there's any cancer at all. These are our exam rooms back here.
Oh, that's very impressive.
And then, thank you. And then this here is just the hallway leading back to our cosmetic center, where we do laser hair removal, laser tattoo removal. We have Botox fillers. So this is the cosmetic room where people get evaluated with Visia camera. There, the camera takes a picture, shows you where every wrinkle, red spot, and brown spot is, and then that gives you a baseline of where you're at, and then you can see what services and products you need in order to improve your appearance. 2 esthetician rooms, microdermabrasion, chemical peels, facials. This is one of our 2 laser rooms. The lasers here are used for hair removal and blood vessel removal. So it's a YAG laser and an alexandrite laser. You need different lasers based on the skin color of the patient. So in order to be safe, you have to use a different laser for a different skin type. Here we have 2 other lasers. It's a this is the Cynosure Smart Skin and the RevLight SI. The Smart Skin is a carbon dioxide laser. It's used to resurface the skin, and the other laser is used for tattoo removal. This is our meeting room. We give luncheons here, lunch and learns, where we talk about different skin conditions. And here's sort of our logo. The practice is Las Vegas Dermatology, and our motto is for a healthier and more beautiful life. And it's really more than just skin. We really want to help people achieve what they want to achieve with their skin and with their lives by making them happier with their underlying conditions. So with that, this is my office. And I guess this is where I'm happy to answer any questions you have about me and Las Vegas Dermatology. And also, I would like to thank the Doctor's Choice Awards for choosing me to be the top doc in Las Vegas. I really appreciate it. And I know that there are lots of wonderful physicians in the city. So for me, I just appreciate being chosen among them to represent.
Thank you, Doctor. Thank you very much for taking us through that tour. That was so wonderful of you. And of course, as Dr. Greenberg just explained, he is a board-certified doctor, and Dr. Greenberg is the first recipient of the Los Angeles Choice Award in Dermatology for 2014. Dr. Greenberg is the man behind the vision of laser dermatology, a board-certified, or as I said, a board-certified dermatologist who is experienced in all factors of dermatology, including medical, surgical, laser, and of course, as he just mentioned, in cosmetic procedures as well. And of course, I must say you're welcome, Doctor, and thank you very much for joining me today for this interview. So if we start with this question I have, I must congratulate you, Dr. Greenberg, on your Las Vegas Doctor's Choice Award. I mean, winning the award. How do you feel? I mean, how do you feel getting the award from Doctor's Choice?
I think it's nice. I think in particular what I like is that Doctor's Choice is a peer-selected award, from my understanding, and it's nice to know that other peers have selected me for such an honor. It's not a paid thing, and there are different paid awards across the country where people get their names on things, but this one is something where people are just selected based on the merit from their colleagues.
Yes, it is. Yes. And of course, I think it's a great achievement, going through what you just took us through the office. How long have you been established in your practice?
So Las Vegas Dermatology started in 2007, and we started off in one room of another doctor's office, and we've grown and expanded to the point where we are now, which is a 5,000 square foot space, medical, surgical, and cosmetic. It took a while to get here, but now we're really rolling on all cylinders, and it's a fantastic place.
Okay. We know it takes a lot of synergy and teamwork to make a successful practice, as you have. We are wondering what kind of culture have you created in your practice?
We have a staff meeting every Wednesday where we get together as a team and we talk about what's going on in the practice. I have an agenda, and with that, I go over the things that are important for that week, and then everybody's allowed to talk about what's going on in their specific section of the practice. And after that, we have a time where everybody says one positive thing going on in their life. So it could be, for me personally, my positive is I'm going to Cannes, France later on this afternoon. I'm giving 2 lectures there on dermatology about social media and marketing. But that was my positive this week. But somebody will talk about their kid and that they're playing baseball and hit a home run, and then another person will say that they're moving to a new house in the Las Vegas Valley. So whatever it is, we have a culture where we really care about one another. And the other thing is we emphasize that the patient comes first. So we're very much a patient-centered practice, and I think that it shows not just in the way that we treat each other, but in the way that we treat the patients.
Yes. You have received great reviews from leaders in the medical industry, and you were also very instrumental in getting other doctors to participate in Doctor's Choice Awards. How did you first get involved with Doctor's Choice Awards?
I'm not sure even how it happened. I think somebody reached out to me either on LinkedIn or from the website itself. Actually, I think I was asked to review a friend and a colleague, and I said, "Wow, this is great because this is a peer-reviewed source." And I said, "I wonder if they would consider me," and that's how that worked out.
Okay. And how did you get into the field of dermatology? Was there a specific moment that you knew that you wanted to be a dermatologist?
Yes. So when I was a 4th-year medical student, I did a rotation in dermatology, and I'd already matched to do internal medicine at Georgetown. But I did this rotation, and it was with my hometown dermatologist, Nate Truckman, in Colorado Springs, and he was doing lasers and surgery, and I had never seen any of these things before, and I was just astonished and excited. And I said, this is what I want to do. I want to do lasers and fillers and Botox and cut out skin cancer. But the problem is dermatology, as you know, is the most competitive field there is. So I couldn't get in right away because there were other people who had already matched, and I was already doing my medicine residency. So every year during my medicine residency, I applied for dermatology. I wrote book chapters and journal articles. I did a year of research in Madison, Wisconsin in dermatology, and then I ended up getting the residency position there and transferring and finishing over at Texas A&M University Hospital at Scott and White, which is in Temple, Texas.
Okay. What advice would you give aspiring physicians regarding education and starting their own practice?
Wow, that's a loaded question. There's a lot of change going on right now with government intervention in medicine and maintenance of certification. In fact, I'm running to be on the board of the American Academy of Dermatology because I think there's too much administration going on and bureaucracy. Being a physician is awesome, and it's fun, and you're affecting change in people and doing things for them that they can't do for themselves. it's a rewarding field, and so I would tell anybody who wants to do it that they should do it, and they're just going to have to know that it's a lot of effort. So for me, it was 11 years of school after college, and the payoff is now where I'm, going to France this week to give a lecture. I'm going to be lecturing in LA the week after, and then I'm going to be giving a talk in Chicago to a group of dermatologic surgeons. So there's a lot of opportunity there, and I'm living in the city that I love, which is Las Vegas, and I'm treating all kinds of people and just having a great time with what I do.
Okay, so tell us about a role model you have in dermatology.
In dermatology,
Yeah.
I would say it's Nate Truchman, the gentleman who I spoke about, whose practice is in Colorado Springs, Colorado, which is my hometown. He's a Harvard-educated physician who is personable, dynamic, good with just dealing with people. And the hardest part of the job in any job isn't necessarily the job. It's dealing with the people that you deal with, whether it's a disgruntled employee for whatever reason, or a stressed out patient who aside from their skin disease, which can be easy to treat, has some other issues that are making their skin condition worse. So Nate is just very adept at dealing with people, and I think he's taught me more in terms of compassion and caring, and I think that is an important part of being an exceptional physician.
Tell us about a time when you had to face a challenge as a leader.
As a leader, I think my challenge was the first time I ever had to fire somebody. That was awful, because I really liked the person, but they weren't really doing their job, and the patients come first. That's why we're here as physicians. So in this particular case, they weren't doing what was right for the patient, and that reflects badly on. That not only can it have a bad effect for the patient, but it reflects badly on me and on the practice. So that was an important turning point, was that nobody is that important or that necessary to the practice. We really need to put our patients first.
Okay. So how wonderful. I mean, thank you very much, Doctor. I mean, it has been wonderful speaking with you, Doctor. And on behalf of Doctor's Choice Awards, I wish you all the very best. And thank you once again for making the time to be with us.
Thank you, Thalini, and I really appreciate Doctor's Choice for choosing me to represent Las Vegas. Again, I'm H.L. Greenberg from Las Vegas Dermatology. lvderm.com. The Twitter is lvderm. So thank you again. Really appreciate it.
Okay. Good day to you, Doctor. Bye-bye.
All right. Same to you. Take care. Bye-bye.